Chairman.
5 minutes.
Thank you very much, and let me just say what a pleasure it is for me to be here today and rejoin the committee that I served on for 8 years. And I want to thank you for your leadership, and I want to thank also Mr. Payne, whose subcommittee I served on, for his steady hand in so many issues that we're addressing that relate to our foreign policy. And it's especially poignant for me to be back here as my first day as we take up this legislation reauthorizing PEPFAR. And as you said earlier, I was one of the original co-authors of PEPFAR back in 2003. And it's an issue that I have worked on for many, many years and had the privilege to work very closely with Chairman Lantos and Chairman Hyde over the years. So I'm very saddened that they are no longer with us to witness this today. I know that they would have been very pleased with the bill that we have put together. And Mr. Chairman, I again especially want to thank you and our ranking member, Ross Layton, and all of our staff, and I want to thank my staff, Christos Santos, and all of the Democratic and Republican staff for this bill, because I know it's more than just a bill for them. It is a mission, and it is about their life's work, so I have to thank them very much for that. And I know that Chairman Lantos very much wanted to have a bipartisan compromise on this bill, and in many ways I think that this is a testament to his legacy, that we could all come together and negotiate this bill. We spoke very often about this. We have to give on a few issues, just as our colleagues on the other side of the aisle had to give on a few issues. But what's important is that this is a compromise, and that's what this is about. Of course, I would have liked to have seen Mexico City language repealed, but of course we could not do that in this bill. So in the end, I think we do have a good bill. We agreed on $50 billion over the next 5 years for HIV and AIDS, TB, and malaria. We agreed on the need to, as Mr. Payne said earlier, to expand linkages to other core health and development programs like food and nutrition, family planning and maternal health, and education initiatives. And we did incorporate provisions of my bill, the Pathway Act, H.R. 1713, and also the Africa Health Capacity and Investment Act, H.R. 3812, in this bill. So that we could build on health capacity, train and retain new health workers, strengthen healthcare systems, and provide women with the tools that they need to address this pandemic in a way that is devastating their lives each and every day. Many of us have had the opportunity to visit Africa, and let me tell you, we have seen these programs working, and they are benefiting individuals, women, children, men, and we've seen this over and over again. But also we listened over the last 5 years to what changes need to be made that would make their efforts more effective and more successful. And I'm pleased to say that this bill incorporates many of those recommendations. It will fundamentally help our program move to what it was 5 years ago, an emergency, which it still is an emergency, but we have to have the sustainable components to make this work overall and to make this become truly effective in the interests of what people need throughout the world. And so while I said earlier, as I said earlier, we have to give up on several things that were important to me and to many and members on this side, I believe that the compromise we have is worth it. And I can tell you that the relevant funding programs hopefully will be able to fund. It's very good, I think, to work with the appropriators and the authorizers on this effort, and I hope that we can meet the $50 billion level. I know certainly I'm going to do my job to make sure that we try to get to that. It's very important that we meet this $50 billion goal. And so I think in the next 5 years we will be able to prevent 12 million new HIV infections. We will be able, as the bill calls for, support treatment for at least 3 million people with a goal of 450,000 children on treatment. We will be able to care for 12 million people affected with HIV and AIDS, including 5 million orphans and vulnerable children in communities affected by HIV and AIDS. Though we may not be able to do everything we need to and want to do in this bill, I think this is a major, major step forward. And Mr. Berman and Ms. Ross Layton, I have to thank you and Congressman Payne again and this committee for such a fine bill, and in Chairman Lantos and Chairman Hyde's memory, Let us do the right thing. Let us honor their legacy, and I salute both of them for their commitment to address the greatest humanitarian crisis of our time. Thank you again.
Well, thank you.